and Stephen Dorrell, a former Health Secretary who now chairs the NHS Confederation. Aileen, can I just come to you first? There are many who will find the CQC report shocking. You, however, are not surprised. You've seen it all.
It's basically, I've heard this for 18 years. Every year they announce a certain amount of homes are terrible and it's not acceptable and we're going to have a tougher new inspection regime. And we end up with a regulator that's got enough teeth but no inclination to bite. There's also matters where the regulator has actually disclosed the identity of 47 whistleblowers, inspectors at the CQC, to their employers, resulting in people being pushed out of their job. Now, you know, there's an awful lot of talk about retaining staff and that we need to retain staff. However, the very staff that they need to retain are the staff that do not have jobs, they're the whistleblowers. And every day we are dealing with hundreds and hundreds of whistleblowers, and we've actually submitted to government comprehensive reports, which are up on our website. I'd urge people to look, Breaking the Silence reports, and which we continue to gather.
And you feel nothing's changed?
And nothing has got any better. And there's an unwillingness to, you know, to accept the problem here, that whistleblowers are not protected. And to be quite honest, the CQC are re-registering care providers across this country as new care providers and misleading the public. And we've highlighted this as well on our website.
Stephen Dorrell, as a former Health Secretary, just what is going wrong in the care sector? We've heard this so many times.
Well, I absolutely agree with Eileen that we've heard it over a protracted period. We've heard it in particular, of course, from the CQC. Last autumn, they said that social care was approaching a tipping point. Today, they say safety in too many care homes is fragile. And what's required, I think, is two things. First of all, we do have to address the financing of social care. That's something the government did on a short-term basis in the budget. It provided an additional £2 billion this year. But it set out, the Chancellor stated clearly in the budget, we need to look for a longer-term solution for the funding of social care.
So it's not just about money, then?
But there are two things. As I said, it's partly money, but it is also partly, importantly, about joining social care into the rest of the care system, and in particular the National Health Service, because the National Health Service can't do its job if social care isn't doing its part of the job.
Can I just cut in there, actually, a couple of points. Firstly, we did an FOI to the NHS recently asking how many people were actually in bed-blocking beds that had come from a social care setting in the first place. And the NHS replied they do not know. So firstly, that's an issue. Not everyone that's in an NHS bed is somebody who, you know, has come from home. They often do come from social care settings who have failed them in the first place. Second point is, I've been in care homes across this country, hundreds of care homes undercover. I've been on 2 care homes on one street. Both of them were rated the same by the CQC. One of them was £100 cheaper. The one that was £100 cheaper was heaven. The one up the road was hell. So it's not just about money, because the money that's invested in social care has been invested in private companies.
OK, well, we'll come to that in a second, but money is important, and under this government and the policy of austerity, things are getting worse.
Well, and the government has recognised the need to address the finance question in the short term. That was where the £2 billion additional spend came for this year. But the government has also recognised, and this is, I think, the important point, that we need to look for a longer-term settlement that does address the need to join social care more effectively into the NHS system. And if I could just pick up Eileen's point, it's actually in today's CQC report that one of the aspects of safety that doesn't get delivered as consistently as it needs to be is medicines management within care homes. Now, if medicines aren't delivered effectively within care homes, that leads to demand either in the primary care system or, in worst cases, in the hospitals. And so we quite often talk about discharges from hospital into social care. That is an important issue, but it's not the only issue. Social care needs to work across the range of social care in order to support citizens leading the lives that they can lead.
Can I get you quickly just to respond to that?
Yeah, I'd just say as well, many of the concerns we are receiving, which have gone to the CQC, families, we see both sides, the families who've lost loved ones in appalling conditions in this country. It's hard, you know, to believe, and I see that every day. And whistleblowers who've lost their jobs because they cared enough to speak out. At the end of the day, throwing money at it, money that will never reach the care workers, they won't receive the money. We are financing private companies who are not delivering the care, and that is the key that we need to look at. Are these companies fit to be paid this money to provide care?
Eileen Schaub, Stephen Dorrell, thank you very much. John.
Still to come tonight, France says it will stop the sale of diesel and petrol cars by 2040 to meet climate targets.